Breast augmentation is one of the most common procedures that we perform. The procedure is oftentimes used to add volume or replace volume the patients otherwise feel they don't have. The procedure is performed as an outpatient procedure where patients can go home the same day. We offer patients the option between saline and silicone implants, and it usually depends on which type of implant they are comfortable with that helps them decide which implant we will use for them. When we evaluate a patient for a breast augmentation, we have a careful conversation with them about what their goals are and what they would like to achieve with the surgery. We also take a look at their bodies to identify asymmetries that they might have between the breasts and make sure that they're a good candidate for the procedure before they proceed. The surgery itself normally takes roughly about an hour, and it's performed as an outpatient procedure so patients can go home the same day. The procedure is most commonly performed through an approach underneath the breast. However, there are other approaches around the nipple and through the armpit which can be employed for some patients. The procedure is very safe, and we perform hundreds of these procedures every year. There are two types of implants that we offer, both saline and silicone implants. The silicone implants have two kinds of silicone in them, including an outer shell which is made up of a solid phase silicone, while the inside is filled with a gel phase silicone. The saline implants also have a solid phase silicone shell, however the inside is filled with saline or IV fluid, which is thought to be very safe for the body. Both implants can have similar appearances from the outside, and if patients have some breast tissue to work with, they can also feel the same from the outside. For some patients who have very little breast tissue or who are looking for larger implants, then sometimes the silicone implants are supposed to have a more natural look or feel to them. After a breast augmentation, patients can experience a wide range of different levels of pain. Many patients feel that their breasts are too large and too high and too tight to begin with, and then after a couple of weeks, the tissues begin to stretch and relax, and the breasts settle into position. Breast implants are not permanent devices, and we expect they're going to wear out within the lifetime of the patient. Oftentimes with the saline implants, patients will know when an implant goes flat. However, with the silicone implants, since we can't always tell when the shell wears out, those patients are encouraged to undergo MRI scans beginning 3 years after the implants are placed, and then every other year after that. There is more information for this and other procedures throughout our website. We offer free consultations, and we encourage anybody with additional questions to contact our office to schedule an appointment.